Our understanding of death, I think, has changed dramatically, especially in recent years, but even over the last several centuries. You know, for most of human existence, death was primarily a spiritual reality. There were really no hospitals, there wasn't much health care to go around. And so when people were dying, it was usually the priest that was there to go through that process with them, if they even knew they were dying. You know, through most of history, people didn't know they were going to die because they died from infectious diseases or accidents. We're in a very different situation today. Only about 10% of us will not be aware that we're going to die. Most of us will have progressive illnesses, and we're going to have an opportunity to prepare for death. In the Middle Ages and later, especially after the plague, which killed, you know, hundreds of thousands of people, and it also killed a lot of priests. The church asked a Dominican friar, who was probably dressed something like I am today in the 16th century, to write a little handbook for people to help them with this process of dying. And that literature was called the Ars Moriendi Literature, the art of dying. And these little booklets were really kind of self-help guides for the dying person, who was surrounded by his family and friends, and it involved prayers and questions and all kinds of things that would help the dying person prepare for this ultimate journey. All of that changed with the Enlightenment when we got to the 18th century, when really medical science began to develop and spirituality was replaced with science. Now, there are lots of benefits from that, and we've all benefited from advances in medical science, but I think the dilemma we face today is that we've really lost touch with the spiritual dimensions of dying and the reality of what death means for us today. It's been kind of overwhelmed by the scientific and clinical aspects. I think accepting limits and accepting our mortality are huge challenges for us today, partly because medicine, great as it is, has sometimes almost given the impression that maybe we don't have to die. There might be a way out of it. And it's a dilemma not just from a personal perspective in terms of my own dying, but it's even a political issue. You know, I've often said that I don't think we can achieve any meaningful healthcare reform until we accept the reality of death and mortality and our own limits. I remember the ethicist Dan Callahan once saying that if we could only see death as the natural outcome of all healthcare, our attitudes would change. But we're not even there yet, and I think this impacts both patients and physicians and other caregivers, because they deal daily with the reality of death and dying, and they don't always have the spiritual wherewithal to cope with it. The Ars Moriendi literature that I referred to earlier, all the woodcuts and illustrations of this show the patient surrounded by family, friends, clergy, saints, even demons who were seen as kind of battling for the patient's soul, but it was very much a communal experience. And yet we know that a lot of times patients die alone in intensive care units. It's the last place they want to be. And what can we do to bring the process of dying back into a community context and allow others to be affected by it? You know, we sometimes say, well, I don't want to burden someone else with my illness. Well, illness isn't just my problem. It's part of the social condition, the human condition. And dying is something that we need to experience together. I think if we do that, we're going to be a lot better off.